That looks good. Let's get started.
Well, good afternoon, everybody. My name is Jess Ghannam. I'm a professor of psychiatry at UCSF. I'm Palestinian. I've been working in Gaza for 25 years, and we're joined today with my amazing colleague, Dr. Rupa Marya. I'm going to let her introduce herself right now, and then we'll get going. Rupa, please introduce yourself.
Hello, everybody. I am honored to be speaking with you, Jess. Just so grateful to be in your company and to be in a community with you. I am speaking to you from the occupied, unceded Ohlone territories of the Ramaytush language group, where I was born and raised. My family is Punjabi from Patiala, up north of what is now called India, and I'm just really grateful to be involved in this discussion of understanding how these dynamics are affecting people and what role we can play as healthcare workers to move the needle.
Thank you, Rupa. So why are we here today? Today, December 11th, 2023, is part of a global strike that's being called on behalf of Palestinians to the global community to strike and to make their voices heard to demand an immediate ceasefire to the genocide that's occurring in Gaza right now. In addition to an immediate ceasefire in Gaza, there's a demand to let the humanitarian aid come into Gaza together with medical supplies, which have been denied entry now for a number of days. As we're speaking right now, the death toll in Gaza is above 17,500. 70% of the individuals that have been killed right now are women and children. 1.8 million Palestinians are internally displaced. And according to the UN and the World Food Organization, imminent starvation is affecting the majority of Palestinians on the ground right now. Starvation is imminent. Medical crises are imminent. People are dying every single moment in Gaza right now. So the demand for a ceasefire has real on-the-ground consequences. The sooner we get to a ceasefire and the sooner there's a resumption of humanitarian aid coming into Gaza, that will save hundreds, if not thousands, of lives that are at grave risk right now. So why are we here today? What is the role of health professionals in this? Health professionals have a special, unique, moral and ethical obligation in terms of what's happening in Gaza right now. We know, for example, that since October 7th, hospitals in Gaza have been actively targeted. Physicians, nurses, and healthcare professionals have been targeted, have been killed, have been captured, have been held hostage. And as we speak right now, there isn't a single completely, fully functioning hospital anywhere in the Gaza Strip. Half of the hospitals have been so physically damaged, it's unlikely that they'll ever function again. We know that where we practice as healthcare professionals, as nurses, as physicians, these are very sacred places. And that sacredness of the spaces where we do our work is being violated. And healthcare professionals and physicians in Gaza are calling to us, demanding that we stand up as health professionals with our special duty and our special obligation, because when one healthcare professional dies, a piece of us dies. This is the first time in organizing for Palestine that the healthcare community has been rising up globally to see their unique place in the Palestine Solidarity movement. And we are calling on all healthcare professionals to stand up, to take a stand, to demand an immediate ceasefire, and to demand the resumption of humanitarian aid coming in to the Gaza Strip. That's why we're here today. And I'm hoping that the discussion that we have today is going to cover a wide range of information, a wide range of ways that each and every one of us can plug into as healthcare workers and whatever you do into the Palestine Solidarity movement. There's a lot going on today. And this particular week, this day, the global strike in solidarity with the people of Palestine is part of a week-long series of actions that's also being called to demand this ceasefire.
Dr. Ghannam, I'm going to call you Jess, if that's okay, because that's how
Please.
I know I love you. Jess, I'm wondering if you can help us, for people who've not been involved in decolonial struggles, who are coming from the global North perspective, especially here in the United States, where the U.S. was the one to veto the ceasefire resolution in the UN. But Joe Biden then went around Congress and sold more weapons for more killing of civil, just a huge proportion of civilians in Gaza. So can you talk to us just really briefly about the history of the Palestine Solidarity movement and how health workers who don't yet have an orientation can show up right now, what they need to know to show up in the right way?
That, Rupa, that's really a great question. And I just want to dovetail on something you've said about the veto in the United Nations Security Council. This is really incredible. So you have a global community who has stood up and said, ceasefire now. I mean, this is unprecedented in terms of global solidarity. And in the UN Security Council, which doesn't agree on much these days, there was, except for one country in the Security Council, two countries, one that voted against and one that abstained, a unanimous commitment to a ceasefire and the resumption of humanitarian aid. It's really important for people who are wanting to work in solidarity with Palestine and with the Palestine Solidarity movement to understand where power is. The United States was the only country to veto the resolution to demand an immediate ceasefire. Now, think about that. They're not saying who's at fault, who's not at fault. They're not saying anything other than let's stop killing civilians. Let's resume humanitarian aid so that people do not starve to death. And it's important that we all are crystal clear that the only country that's really stopping this genocide that's occurring against Palestinians in Gaza right now, and in the West Bank, I might add, in Jerusalem, is the United States. And as you said, Rupa, it's especially painful to understand that the President of the United States and the State Department decided to bypass the Congress and send special two kinds of weapons, okay? 2-ton bunker busting bombs, which have a destructive power that is unimaginable in the modern era in terms of its concussive effects and the devastation that it has on civilian populations. They authorized that be sent to the Israeli military, and special tank cells for the Makerva tanks, which are incredibly destructive. They bypass the Congress and they're sent. Okay, let's keep that in mind, because as we try to unpack and understand the role of power and why the United States is so committed to this genocide, along with Israel, we need to understand the dynamics. But before we get to that, I think it's important for all people who are, especially healthcare workers, some of you may be new to Palestine Solidarity work. And what's really important to understand is that Palestine Solidarity work did not start on October 7th. The Palestinian struggle for freedom, for self-determination, and for liberation is about 100 years old. And the intense part of that struggle has been for 75 years. It's a long struggle. It started after World War I, after the colonial powers divvied up parts of the Middle East. Britain, the UK, got parts of Palestine and were colonizing it. And in 1918, after, and people should read about this, we don't have time to go into it today, the Sykes-Picot Act and the Balfour Declaration, where all these deals were being made after the British kind of took over historic Palestine and were ready to have settler colonialists from Europe, Jewish white settler colonialists, come to Palestine and basically take over and colonize historic Palestine. And that took off in 1947, when that settler colonial project really took hold. And from 1947 to 1949, and this is really important, 800,000 Palestinians were ethnically cleansed and forcibly removed from their towns and villages, created the largest refugee problem in the world. 500 villages were depopulated between 1947 and 1949. And it's important to understand that that decolonizing settler colonial project started before Israel declared itself as a state. So when all of that happened, Palestinians were resisting the colonial settler project very strongly starting in 1948 up until where we are today. And it's important for those of us who want to work in solidarity with Palestinians in Gaza and the West Bank and all of historic Palestine, that we understand that really what we're fighting and what we're resisting, what we're trying to overcome is a 100-year settler colonial project that is attempting to ethnically cleanse Palestinians from their indigenous connection to the land. Why is that important? Because what you're hearing and what the way in which it's framed by non-Palestinians is that this is a very complex issue. No one can understand it. It's been going on for thousands of years. All of the rhetoric that we kind of hear, it's so complex, we can't really understand it. When in fact, it's been going on for about 100 years and more intensely 75 years. And that settler colonial projects, which we all understand, if we have a connection and understanding of the settler colonial project here in the United States with our indigenous communities, and the fight for equal rights and self-determination with all of our communities of color here in the United States, from the African American community to the API communities to our Latino brothers and sisters, all of these struggles intersect with what's happening in Palestine, because really what Palestinians are demanding and insisting upon is dignity, is respect, is equal rights, and a commitment to reconnect to their indigenous lands, which has been forcibly taken from them. And if you can begin to understand that struggle, then the line from 1918 through 1948 up until 2023 really makes sense. Because for Palestinians, the struggle has been going on for a very long time. So after October 7th, the intensity of the resistance and the attempt to remove any semblance of Palestinianness, indigenous Palestinianness from historic Palestine is trying to be erased by the Israeli government and the Israeli military. That's what this is about. And I'm going to send it back to you, Rupa. That was a mouthful. I know I kept going there, so excuse me for that.
Well, it just makes me think, Jess, about the weaponization of identity. Like this is a very, that Jewish people do have ancestries in the same area, but the way that power is racialized in Israel, with the political and economic power really being held by people of Ashkenazi heritage who are predominantly from Europe. And the other kinds of people who are there, Ethiopian Jews, Palestinian Arabs, that's just
Palestinian Jews,
Palestinian Jews, just that, and Bedouin peoples. There's so many different kinds of people there, but the system of racialized supremacy exists there as well. It's not simply just Jewish supremacy; it's a kind of racialized supremacy as well, and that to the claims of indigeneity that I'm hearing as a refutation to some of the perspectives that you offered, to say, well, this isn't settler colonial because we've been there before thousands of years ago. That's simply not true. Just because you have, let's say, indigenous claims to an area doesn't mean you can go in and kick people out of their homes and institute a system of supremacy and an apartheid reality, which is what has happened in Gaza, the West Bank, all through Palestine. And so my work is to really think about and look at how the health impacts of settler colonialism, and also not in the wake of the world that has been structured through colonial capitalism. So when you were talking about 1918 and the fall of the British Empire, and the way in which European powers carved up the rest of the world that had previously been under their direct exploitation, extraction, and colonization. We see the same dynamics in Kashmir, with India in Kashmir. We see the same dynamics repeated all over the world, where peoples who had, prior to European colonization, had pluralistic, societies, had different ways of interacting, had not just anti-capitalism in terms of preceding capitalist arrangements of economic relationships, but specifically anti-capitalist relationships where people were organizing and working in terms of trade, in terms of how they were going to be together in relationship to one another and the earth in completely different ways. And so the colonial project comes in and erases those histories, erases our relationships to our lands, to our foods, which is why the olive groves are targeted, which is why the farms are being burned, which is why Israel has poured concrete into agricultural wells just in August of this year. So when we see that, what looks like a settler colonial project, in fact, is a settler colonial project, is following the long line of history of these projects. And so I would like to ask you, in your research, what has been the health impact of, when you're talking about the last 75 years in Palestine, what has been the health impact in terms of, health outcomes for Palestinian people living under this apartheid situation?
Yeah, that's really a great explanation, Rupa, and really excellent question. I do want to just go back and emphasize the point that you made, because it's really important for people to understand that there have been Jews, Christians, and Muslims in Palestine forever, for a very, very long time. And historic Palestine, which is where my family is from, and the stories that I would hear from my grandparents, Palestinian Jews, Palestinian Christians, Palestinian Muslims coexisted in this incredible multi-ethnic, multi-racial, multi-religious society. There has never been an objection to Jews, Christians, and Muslims living together in historic Palestine. That's never been the issue. The issue comes when someone wants to remove you from your own land, wants to disconnect you from your historical connection to your land, and essentially take your land away and have a special claim. And your analysis of that really needs to be kept in mind, because this is really classical settler colonial projects. Okay, the health consequences in historic Palestine after 75 years of occupation have been devastating. I mean, the long-term health consequences, we can look at the numbers, which are very staggering. We have to keep in mind, like, within the confines of historic Palestine as it exists right now, where Israelis and Palestinians live, on the Israeli side of the equation, they have a world-class healthcare infrastructure, and the healthcare metrics among Israelis is comparable to the healthcare numbers that we see among white Americans here. They have access to top quality care, primary, secondary, and tertiary care. The health outcomes in terms of infant mortality and maternal care are just, as good as anywhere here in the United States. The management of chronic illness is, comparable to what we have here in the United States. But when you look at the Palestinian side of the equation, less than a kilometer away in terms of neighbors, you see very dramatic differences. For example, I mean, among the most dramatic healthcare consequences of living under occupation is just life expectancy. So Palestinian life expectancy, and check this out, is 10 years less than the life expectancy for Israelis. 10 years for neighbors right next to each other. Now, in terms of a health disparity, that is extraordinary. Let's look at another metric, which is really profound and significant, which is the infant mortality rate. The infant mortality rate in Israel right now is about 3. What is it for Palestinians? It's about 18.7. And if you look at infant mortality rate now in Gaza, it's closer to 27, 28, and even approaching 30 right now, because we have 50,000 pregnant women in Gaza right now who are giving birth, who are about to give birth, or who have given birth without any access to maternal health, without any access to a hospital, without any access to midwifery, without any access to, if they're having a difficult or complicated pregnancy right now. So the infant mortality rates are of a staggering difference. Let's look at child health, for example. Stunting among Palestinian children compared to, like, the growth curves among Israeli children. Again, not just statistically different, but clinically significant, because prior to October 7th, 80% of Palestinian children in Gaza were living on less than $2 a day. And just imagine that. When you're getting your coffee in the morning from wherever you get your coffee, you're spending well over $2. That $2 is really the max in terms of feeding the over a million Palestinian children in Gaza, and that's before October 7th. So growth curves are dramatically different. I mean, there's not a metric anywhere in terms of what the WHO looks at, in terms of access to primary care, access to secondary and tertiary care, the development of chronic illnesses, where there aren't massive disparities as a result of the occupation and colonization of historic Palestine. And as I like to say, occupation and settler colonialism is not good for your health. And just to make the connection here, well, let's look at our communities here. Let's look at the health disparities among the African-American community and the API community and the Latino community in all of our disadvantaged communities here in the United States. We have a so-called world-class health system here, but we see that the dynamics of power impact health disparities in very dramatic ways. And so what we're seeing in Palestine mirrors the health disparities that we see here. And in terms of intersectionality, and this is really important, this is why we as health professionals need to really get on board with Solidarity with Palestine. We see the same health disparities. Maybe more dramatic in Gaza right now, but it's the same health disparities nonetheless.
Yes, and that's an excellent point. So when you say that 10 years less life expectancy, I think even between Pine Ridge in Lakota territory, so Lakota community were the fiercest resistors of Western colonization here and occupied Turtle Island. They have now the worst health indices in the Western Hemisphere, second only to Haiti, the only place of a successful slave rebellion. And so I think that these things are intentional. The wide difference in life expectancy, I think in Pine Ridge, it was somewhere around 57 years when I last checked, and 10 miles away in the Dakotas, it was 30 years greater, which is just wild. But when you say 10 years difference, it makes me think of East Oakland and 7 miles up in Piedmont. So the people who are sucking in the air of the 880 and forced to breathe the air of the ABNI foundry that we successfully shut down in our community activism, that these industries, which have been always a part of the governments that have established settler colonial governance. For example, Exxon and Chevron, and their participation not only in the damage of the Amazon and making people in Richmond not breathe, and also their participation with this current act of genocide. These things are all interconnected. And so they must be addressed globally, because they are a global threat to public health, to our health and our communities. So I think it's actually really important that we understand and start to make these connections, as you are, that solidarity with Palestine is also solidarity with our Black and brown and poor communities in East Oakland, and also the people who are forced to suck the air of the oil refineries throughout the Delta here in this area where we are in Ohlone and Pomo territories and Miwok territories. And so
While Rupa is tending to that, I just want to make another kind of impact in terms of health consequences, which is really important, which Palestinians really understand, is that historically, for many hundreds and hundreds of years, Palestinians were primarily an agrarian society, in that our connection to the land and being farmers and tending to the land was incredibly important. And that was reflected in our health outcomes early on, and reflected in the kinds of diet that we had. Why is that really important? Well, because as the evolution of and the kind of taking over the settler colonial project, part of what happens with the land that is being taken from indigenous Palestinians, it's primarily the farmland. And Palestinians not only have their farmland confiscated by settlers, they also are prevented from tending to their farmland. So one of the things that we're seeing in the last 15 years to 20 years, when the settler project has been really getting amped up, is that the Palestinian diet has changed significantly from whole grains, whole foods, what we here in the West called farm to table. That's the Palestinian deal. I mean, we go to our fields, we pick our food, our fruits, our vegetables, it's directly to the table. Because of the settler colonial project and the attempt to disconnect Palestinians from their connection to land and farming, the diet and the consumption of fewer and fewer whole foods has resulted dramatic increases in cardiovascular disease, dramatic increases in metabolic disorders, dramatic increases in all the chronic diseases that we see with these dramatic changes in diet. So that's another element, Rupa, of the colonial project, is to disconnect people from their connection to the land and their ability to literally live on the land, with the land, and in that kind of connection with the land.
Yes, and that is the premise of the book that I wrote with Raj Patel called Inflamed, Deep Medicine and the Anatomy of Injustice. And it looks at how our critical relationships that are necessary for our health, our relationship to the land, our relationship to the web of life, our relationship to one another, when those have been disrupted through colonial cosmologies and arrangements of power, our bodies experience damage and damage signals. And those damage signals are what our immune system is responding to in terms of manifesting chronic systemic inflammation. And all the diseases you've mentioned, metabolic disorder, cardiovascular disease, cancer, Alzheimer's, depression, what we're seeing disproportionately represented in people crushed through this system are inflammatory diseases. And so in order to address these diseases like actually effectively, we have to take on these structures of power. And this leads us to this question that's come up in our Q&A about, here we are wanting to, as healthcare workers, organize within our spaces of work. We're seeing that the total siege on Gaza cut off all food and water and medicine and fuel. But there was a blockade for 16 years, so these things were very hard to come by anyway. So once there was targeting, bombing of hospitals, killing of doctors and nurses, medical workers and patients, and a restriction of humanitarian aid, then we get this, what we're seeing is genocide. It's a targeted attack. So as we as healthcare workers have witnessed this, and we go to the AMA and we go to our universities and we go to the places of our work and we raise our voices and we say, this is totally terrible and wrong. We need to speak up. We need to organize. We're noticing crickets. No one's saying anything. No one is.
Well, it's worse than crickets, Rupa.
Right.
So here's the thing. It's worse than crickets. Crickets. Let me just take a step back. Physicians, healthcare workers, moral clarity, moral ethical clarity in your careers is one of the most important things to have as in a successful career. We are at a moment where profound moral clarity and ethical responsibility is at a maximum right now. If it were just crickets, that would be one thing. But there's active pushback from medical societies like the AMA, when we're going to get to an example of that in a minute. There's active pushback from organized academic medicine. There's active pushback from the leadership in hospitals and clinics, which are part of this system of power and control here in the United States. So silence would be one thing, but active pushback. So for example, Rupa and I and our colleague Lee Kimberg, we wrote a letter denouncing the fact that the AMA had been silent, even though the AMA had been very vocal in condemning the attacks that Russia had on Ukrainian hospitals and clinics and healthcare workers. They refused to take a stand on the targeting of hospitals and clinics and doctors and healthcare workers in Gaza. We confronted that, and we wrote a letter to the AMA. In their viewpoint section, it was rejected, to put it mildly. And this is coming on the heels of one of the leaders in the AMA making these morally ambiguous comments about, well, maybe bombing hospitals isn't so bad if they're hiding terrorists. This kind of moral justification for taking out hospitals, clinics, physicians, and healthcare workers, which is completely unacceptable under international law, under moral authority, under ethical considerations. It's never justifiable to attack a hospital, to attack patients, and to attack healthcare workers. And we were wanting to push back on that and demand that that be withdrawn. And guess what happened? It wasn't crickets. It was an active rejection of healthcare workers, of us being able to confront that moral. I mean, they call it moral ambiguity. I call it moral depravity. That we cannot even condemn the fact that hospitals and clinics are being targeted and patients are being killed. And I mean, Rupa, I'll let you tell the rest of the story because it's very disturbing.
Yeah, I think that for me, what really has caused a lot of opportunity to reflect on the farcical nature of health equity as an institutional entity within medicine, that we've had 20 years of investment in health equity, anti-racism task forces, and in this moment where we're seeing people enact this great health inequity through bombing hospitals and killing patients and doctors. Several doctors and nurses are now have been kidnapped. That these are moments where we, have to reflect. Oh, hold on one second.
Yeah, I'll just kind of dovetail on what Rupa was about to say. Those of us who are working in the Bay Area right now and other areas where we have clinics and hospitals, and we're going to our administrations, let's say we're going to our leadership and saying, we need to make a statement, we need to organize, we need to get supplies, we need a statement from organized medicine and healthcare systems that is clear, that is unequivocal, that it's never okay to bomb hospitals and to target healthcare professionals. It's never okay. Every time, and there's no exception to this, unfortunately. The messaging back has been, oh, we can't talk about that. It's too complicated. It's gonna create discomfort. And or when we write letters, and I can tell you in the UCSF space, hundreds and hundreds and hundreds of letters were written to UCSF leadership demanding that a statement be made to take a stand against the bombing of hospitals and the killing of healthcare professionals. Silence. So we need to understand what that kind of message, what's the messaging there, right? We have guess what? As healthcare workers, we have difficult conversations with our patients and our families of patients every single day. The idea that we can't have difficult, principled conversations about what's happening when it has a direct impact on healthcare is absolutely bizarre. And it's this conspiracy of silence, and it tells you about the nature of power in the healthcare space, in academic medicine, and the attempt to silence this very important historical moment that we're in.
And it's not just, and pardon me, because my kids are home. So it's not just in academic medicine too, though, Jess. We're seeing, University of UPenn president resigning after making, being put in this, run this gauntlet from, very right-wing conservative congressional person questioning her about her statements not condemning the genocide. Are you not condemning the calls for genocide against Jewish people? And in all of the experiences I've had in multiple academic spaces, I have not yet heard a single call for genocide against Jewish people. I have seen a rising tide of support and solidarity for Palestinian people. And to equate that, people standing with Palestinians in their quest for liberation, in their quest not to be oppressed, in their quest to not have to live under an apartheid reality, though that is not the same thing as calling for the genocide of Jewish people. And so to be put in a situation where one has to answer these questions, as opposed to being asked, does your university condemn the genocide that's actually happening right now? Not the call for genocide, but the genocide that's happening right now. And so what we're seeing, not just in the medical institution, like why does the anti-racism task force at UCSF not make a statement about an actual genocide happening right now that's being funded with US dollars, where weapons that are coming from our taxpayers are going to be dropped on these hospitals, that it's specifically targeting the healthcare system. And there's complete silence. So this to me speaks to why we don't actually have a movement to close the gaps of health disparities in the United States, despite 20 years of the Health Equity Project. And the reason why is because we're not looking at the right thing. When we're talking about health equity, we're talking about all sorts of things except for the structures of power that need to be transformed to make medicine work for all, to make medicine serve all. And if we can't, in the face of this kind of egregious violence, come together and say, this is wrong, this should stop, these people need help. On all sides, people need help. I mean, if you're committing these kinds of egregious acts of violence, that's a level of, those people need a significant amount of help as well, to think that this is justified, to think that this is right. And so I think that for me, this is a very interesting moment, because I've always been skeptical about health equity as something that's been owned by these institutions like the AMA, like our various universities. Because when push comes to shove, and we're in a moment where we're seeing, do Black lives really matter? And do they matter, and how much do they matter? Do brown lives matter? Do lives that have been relegated to the undesirables of colonization and colonial societies, do they really matter? And what we're seeing right now is they don't, not within the academic framework, not within the institutional framework of medicine. And to me, the fact that this is the reaction points the direction to where we need to go as a group of people to actually change health outcomes, is to find out what are the powers what are the structures of power that have made it so hard for any medical institution in the United States to say this is wrong, that hospitals should never be bombed, that patients should never be targeted, that doctors, nurses, medical workers should never be a part of this kind of violence, because our work is sacred, and our duties to care are sacred. And so when we start to let that go, this is what we see, and it's atrocious.
Yeah, I think that's right, Rupa. And it really speaks to something that you've said, is that the DEI infrastructure within healthcare, the kind of calling it out, I think, is really important, because we value the concept, but we don't value the performative nature of it. Because if it's just being used as a performative element to show, hey, we have this thing at our institution, whatever that institution is, but there's this silence around this active genocide against brown people that's happening right now, and you can't condemn it, that speaks to that hypocrisy and where the power is. And it should be called out. It absolutely needs to be called out. I know we have a bunch of questions. Rupa, what do you want to do about that? People are asking really, really good questions. Should we try to take a few?
Yeah, do you want to start with one, Jess?
Why don't you, maybe you can. Okay, this is a good question, I think, and it's addressed to you, Rupa, but I think it could be to both of us. We've been coming against a brick wall with our professional medical organizations. Their silence has been deafening compared to the vocal position on Ukraine. We said that. Is this wasted energy on our part, or is it worth pursuing?
This is totally worth pursuing, because there are times in medicine where people just have the wrong diagnosis, and when we just get a little more information that is factually based in evidence, we shift and change what we do and how we roll, for the betterment of our medical understanding and for the betterment of the people that we serve. So absolutely, we should continue to be engaging people at work. We should be continuing to demand that there are ceasefire resolutions and ceasefire statements for ceasefire, that we start to look at how to mobilize the resources from within our universities and spaces of work to get those resources out to Egypt and Gaza and to places where we can start to support the rebuilding of that healthcare infrastructure that was specifically targeted, attacked, and destroyed by the Israeli government. So absolutely, it's critical. It's also critical because when you do speak up and then people come at you and say you're being investigated or saying what you're saying is wrong, that's a really important thing to highlight, especially as we have greater and greater numbers of Black, brown, and people from poor backgrounds and racialized backgrounds who are now in medicine. And that we understand why, people are put into different positions of power who have greater allegiances to power than they do to the people that they serve in the communities that they've come from. And so for me, this is an important learning moment. I recommend everybody to do some reading, because that's what we also do in medicine, is we learn. This is an incredible moment to learn what the architecture of power is within your institution. Where are the pieces where things are getting stuck, and why are they getting stuck there? And to have those courageous conversations, to wear your pride in standing with the people of Palestine out loud outside, and to just keep having these discussions and pushing and pushing. Not only is this important for the current situation in Palestine, but it will illuminate for you why the Black, white maternal gaps are what they are in the United States.
Mm-hmm.
Same reason that Palestinian lives don't matter to the US medical institution, the same unspoken reasons that we didn't know that Palestinian lives didn't matter. I didn't know that until this situation just blew it up in our faces. And so these reasons are the same why Native indigenous lives don't matter in the United States, while we have such huge health disparities with COVID. Even if people got to the hospital, they still died more if they were Native American and they had COVID. These are structures that get sedimented, these dynamics of power, what someone wrote in our quick Q&A, the political determinants of health. This is how history and power sediments in the body and creates our possibilities of health or disease. This is exactly it. And so if we want to change the outcomes, we have to change the structures. And for me, like when I hear let's liberate Palestine, I understand that some people think that means, oh my God, that means the genocide of all Jews. And that isn't what it means. And I want to clarify that, because I do this work here in Ohlone territory, where we're working with our Ohlone community to move land back into their hands. And at no point do we hear, in spite of hundreds of years of brutal colonization of Ohlone territory, I don't hear, well, we just want to get rid of you all and have a genocide of everyone who's settled here. There's an invitation to unsettle. There's an invitation to become different kinds of relationships, to work together, to heal what has been broken specifically through colonialism, to heal our relationships to each other, the sacred hoop of humanity, to heal our relationships to the web of life, to heal our relationships to the earth. This is critical work that needs to happen right now in the context of climate collapse. And instead, what we're seeing is a joke of the COP28. We're seeing these nations around the world still jockeying for position for how they're going to hold on to power in the midst of a system that is currently collapsing. And what is at the end of that is the casualty are the children of Gaza. Right now, what we're seeing is just the horrific in our face, description or like enactment of this just huge violence. And it will require collective action to stop. So I'm wondering, Jess, if we can go through some of that collective action as healthcare workers specifically can do right now to stop this violence.
Yeah, and I think that's an important point, because Rupa, you and I get asked all the time, what can we do as healthcare workers? And I think it's really important that healthcare workers can plug in at multiple levels of where we need help. If you want to be in solidarity with what's happening in Palestine, which means you're in solidarity with the Black Lives Matter movement, which means you're in solidarity with what's happening at the border, which means you're in solidarity with all of these struggles that we're talking about, you have to be ready to plug in. And people's risk for plugging in is individual. You have to gauge your own sense of risk. It could be something as powerful. It may seem small to some of you, but to wearing some of the pins that we're having made right now, which are just amazing, that indicate that you're standing in solidarity with people in Palestine, and invite those discussions at work. What I like to say is, have one colleague at a time, one friend at a time. Have that discussion about why Palestine is important, and have that discussion because of your knowledge based on what you heard today and the reading that you're going to do on the intersectionality of the struggle in Palestine with all these other struggles. The other thing that you can do is that there's lots of organizing going on at the next level up. Healthcare workers for Palestine, healthcare workers at all the major academic and non-academic hospitals and clinics throughout the Bay Area. There's somebody doing work at each one of these hospitals and clinics and healthcare facilities, from Monterey Bay to Sacramento to Concord to Stockton and Fresno. People are organizing, and it's pretty easy to connect with these groups, to find a space to find out what's going on, and to plug into some kind of activity. It can be information giving. It could be having a vigil. It could be doing a teach-in like we're doing right now. It can be educating yourself, and all the way up to all the things that healthcare workers are doing, because we do have a special obligation, right? Because healthcare workers, if you look at what happened at the Board of Supervisors last week in San Francisco, healthcare workers were incredibly bold and courageous in standing up in front of the Board of Supervisors in San Francisco, as they were in Oakland, as they were in Richmond, and as they are all over the country, saying ceasefire now, because there is a special obligation that we have as healthcare workers. So you need to plug in wherever your risk level is. You can reach out to us, and we'll definitely help you plug into something. But the point is not doing anything is not an option. Doing something is a moral, ethical obligation that we as healthcare workers have. We have that moral, ethical obligation to do something. What that something is up to you and your personal connection. But we want to urge every one of you to get connected to something, because this struggle is not going to end tomorrow. It's not going to end in a month. But whatever we do to engage in a ceasefire and have humanitarian aid come in is going to save hundreds, if not thousands, of Palestinian lives, especially children. And then even after that, that struggle will continue. So we are ready to engage in a chronic, long-term struggle as we connect with other struggles for equity, for equality, for self-determination, and for freedom of Palestinians and African Americans and our Latino brothers and sisters and our API community and our LGBTQ plus communities, all the communities that are struggling basically for the same thing.
Yeah, there's a great question, like how do you handle, oh, sorry, I put in the chat our Activate Healthcare Workers for Palestine, an incredible toolkit made by so many different healthcare workers, from residents and medical students to faculty in the Bay Area. So you can find ideas there on how to plug in and things you could do on your own or collectively with other people, as well as legal resources available to you as you might encounter different kinds of dynamics to try to stop you from this important organizing. There's someone asked, let's see, the donor structures and how finance holds institutions, hospital. This is actually really, really critical. And then another thing that came up was like, should there be a people of color medical society? I have two thoughts on that. Number one, I actually do think we need to create medical schools where we decolonize medicine, where we really do that work together, so that our medical students don't have to go through the process of alienation that has led to people who are now in positions of power in health equity and anti-racism not to speak up, because they become so alienated from their own selves and their own histories and ancestries, that they're no longer able to speak with the voice that will center the health of all. They're not. They have become contorted into a dynamic of power, or a person that will uphold that dynamic of power. And so I think that we need to have spaces, ultimately new kinds of medical schools, new kinds of hospitals, or go train in places where these things are already happening in the global south, and bring that knowledge and information into these spaces so they can continue to be transformed.
Hey, Rupa, can I just ask that you also put in the chat the video for the Know Your Rights? We did a Know Your Rights symposium with Dan Siegel, who's a civil rights attorney. And it's a very useful video for everybody to watch, because there are special protected rights you have, specifically around free speech and the ability to speak on behalf of what's happening right now with the genocide in Gaza. And also, Rupa, if you could put in the link to the Upstream podcast we did too, because I think that'll go into even more detail with some of the things that we've spoken about today. Because it goes back to what you said, Rupa. Part of what we do in medicine is that we read, we try to, get the best practices kind of understanding of how we're going to do it. And by the way, there is a best practices of how to engage in Palestine solidarity work. And in the toolkit that Rupa put, I wrote a principles of solidarity. I really want to encourage all of you to read those principles of solidarity, because it'll kind of clue you into, like, what is Palestinian civil society asking of us as healthcare workers globally to do? So it'll help contextualize what we're doing. Rupa, there's never enough time.
There isn't enough time. So I see here that the chat is disabled, so I apologize for that, everybody. What I will do is, on the Do No Harms Instagram page, I will post all those links under, it's in our link tree, so everyone can go to the Do No Harm Coalition's Instagram page, and we will post all those links up there for everybody.
There's another good question, and one of the questioners said, is it possible to publish all the questions with answers that people wrote today? And we could try to take that on, Rupa. I mean, I'm looking at some of these questions. They're really great, incredible questions. So let's see if we could save those questions, and then we'll do our best to stay connected to it. Reach out to us if you want to stay connected in some way. And we'll see if we can come up with some of the answers to these really great questions.
Someone asked, why are street medics so badass? And I just have to take that on. Street medics are so badass. They are so badass because they've always been working with movements. They have been doing decolonization of medicine and healing for as long as they've been around. So if you are someone who has been trained in traditional medicine, Western medicine, if you find a benevolent street medic who's willing to take you on and teach you the ethics and ethos of street medics work, I highly recommend you do that, because you will learn a different way of thinking about how to act in solidarity with social movements. Just really quickly before we have to go, the issue of donors. So we know that a lot of these big donors are also supporting propaganda to keep Palestinians erased and not thought of as people who have legitimate claims to their homeland. We know that these donors also are supporting West Bank settlements and supporting, money going to the Israeli army. I am part of an organization called the Deep Medicine Circle, where we're working together, Native and non-Native diasporic people working together to innovate different ways of being together on this planet. And we lost $300,000 of our funding for next year. We grow and give away thousands and thousands of pounds of organic food to give to people who are food insecure in the Bay Area. We have about 2,000 families who receive our food for 40 weeks. And we pay our farmers really well, especially people who've been abused by the agricultural system, doing this work to show what a food system based in dignity and care looks like. And 2 words, I'd never known 2 words could cost so much. Free Palestine, 150K each, gone. So it's real. Like, when you're saying these things, my friends who work in Hollywood have lost contracts, gone. And that is, these are the sacrifices we need to undertake and understand to see the architecture of power and where it lies, so that we can start innovating different finance structures, so we can start innovating different healing spaces where we will never be like in the situation where caring for people in our communities would mean, by that, caring for people experiencing genocide across the way, caring for our Palestinian colleagues here by speaking up in solidarity with them, should not mean that the families in Oakland and San Francisco who receive our food cannot get our food. So that's a critical moment. This is a great moment to look at where are those chokeholds in financing, and how do we start liberating that capital? How do we start liberating those resources to serve all?
So I get asked this question a lot, Rupa. So I just want to end by saying my deep appreciation to all of you who are here today, because I can tell you that I carry with me every day like profound, devastating grief. I have been working in Gaza for 25 years. I've lost 5 colleagues and 43 family members of those colleagues. And I carry this burden of deep grief inside me every single day. But that burden is kind of juxtaposed against this kind of hope and optimism of seeing the healthcare space being activated, and the solidarity movement within healthcare that's happening is bringing me really significant hope and optimism, unlike anything I've ever seen. And just kind of my appreciation to Rupa for just being an awesome comrade and colleague in this work, but also my appreciation to all of you for taking the time today. The fact that you're connecting with us today and learning something about Palestine solidarity work means that this commitment is heard back all the way to Gaza, is heard all the way back to the West Bank, is heard all the way back to Jerusalem, is heard in the Palestinian diaspora globally. And I can tell you, I and my community in Palestine and in the diaspora really deeply appreciate all of you for your solidarity. So thank you.
Thank you so much. We will be coming out with more webinars to teach about Palestinian solidarity, how to show up for healthcare workers to get involved and to learn. So keep an eye out on the Do No Harm Coalition's page. Look out for justice and justice for. Well, do you want to talk about just briefly what you're organizing, Jess?
Well, we have a Justice in Palestine group at UCSF. There's also a Jews for Justice in Palestine at UCSF. We have a lot of organizing going on at UCSF, and that organizing is spreading out throughout the Bay Area. So if you stay connected, we're happy to keep you plugged into all of that and help everybody get organized around this.
Thank you so much, everybody. Take care.
Thank you, everybody.